lingual, mesial, distal, and the incisal view, the root of the tooth, and finally we will recap of the session where it is located. The anatomical position of the lateral incisor is the upper jaw. It is neighbor teeth of the central incisor. It sits between the front tooth, the maxillary central incisor, and sharp canine tooth. It is the second tooth from the middle when you smile. Then we will discuss about the tooth numbering system. The maxillary incisor in the FEI system is 1, 2, and 2, 2. In the palmar notation system is the 2 and 2 with the different brackets. In the universal number system is the 7 and 10. Then we will discuss how and when it develops, the development and the eruption about it. The two development from the 4 developmental lobes, the 3 labials. The 3 labials will be seen, which form the front part of the tooth, and the 1 lingual lobes, which form the cingulum. The prominent part we will be feel in anterior of our tooth. Sometimes the lateral incisor look different, such as being bag-shaped, which appear when the enamel doesn't develop. The crown formation being at 10 to 12 months of the age. The crown eruption is the 4 to 5 year of the age. The eruption age is 8 to 9 years. The root completion is around 11 year of the age. The eruption age is a very learning theme for exam point of view. Then we will discuss about the labial view. The front view we will see and when we smile. The crown shape is trapezoidal in the shape. The cervix part is narrow and the above part is wider. The crown size is 9 mm and the root size is 13 mm. The mesiodistal diameter of crown is 6.5 at the upper, and the mesiodistal diameter of crown near the cemento-enamel junction is 5. The less symmetry of the lateral incisor comparison to maxillary central incisor. The distal side appear more curved than the mesial. The incisal angle, mesioincisal angle, relatively sharp, slight, and more pointed. The distal incisor angle is more rounded and slightly lower than the mesioincisor angle. Then we will discuss the back view of the maxillary lateral incisor. The overall outline similar to the labial view. The cingulum is well developed and more prominent. When we see the anterior root in the lateral incisor, it is slightly off-centered toward the distal side. The marginal ridge is the mesial marginal ridge. It is longer and more prominent toward the mesial side. In the distal marginal ridge, it is some shorter and elevated and some rounded toward the palatal aspect. This ridge frame the lingual fossa. The lingual fossa is the V-shape. It is a concavity found between the marginal ridge of mesial and distal. It is a V-shape when we see the mesial view, the side view from the middle. The crown shape is a triangular or wedge shape. We can see the incisal edge is sloped slightly labial. The co-curvature is incisor third. In we will be seen the root is tapers apically. It is tapers in the last. The teeth appear conical with a blunt apex. The facial surface is slightly convex. The lingual surface show part of the cingulum, marginal ridge, and the lingual fossa. Contact area located at the junction of incision and the middle third. The mesial cemento-enamel junction curvature is greater than the distal. Means the mesial has more curvatures. When we see the distal view, the crown shape is again triangular. The facial outline is curved. The lingual outline show the H-shaped curvature. The height of a contour is facial in the cervical third near the gum line. The lingual also in the cervical third on the cingulum. The cemento-enamel junction curvature is less curved than the mesial side. It is shallow curved towards the incisal edges. The root is also a single conical and taper even the blunt apex. The root surface may have a shallow developmental depression but is usually less marked on the mesial side. The incisal view we will be seen in this video. The overall shape is oval or rounded. The sides nearly equal but the mesiodistally more than the labio-lingually. The labial surface more convex than central incisor. The cingulum prominent and centrally placed. The incisor ledge slightly curved center over root axis. The root of the tooth we will be discussed in this slide. It is usually single root. We will not see any bifurcation in the conical, cylindrical and tapering the cervical region to the X. The root length is approximately 13 mm long. The root curvature is slightly curved distally. The right and the left maxillary lateral incisor are mirror image to each other, but the difference is their root and canals curved in opposite direction but have the same overall anatomy in left and right lateral incisors. The quick recap we will see the location is the upper jaw maxilla immediately lateral to the maxillary central incisor. The 4 development lobe we will see mesial, medial, distals and 1 lingual lobe from the cingulum. The dimension is 9 mm, the round width is 6.5 mm, the root length is 13 mm and the eruption usually erupt between 8 to 9 years of age. Thank you. Please like, share.